ప్రస్తుతం ఉన్న క్యాన్సర్ ట్రీట్మెంట్ రేడియేషన్ ట్రీట్మెంట్ మిషన్లు సిటీ స్కాన్ మీద పనిచేస్తాయి. సిబిసిటీ అంటారు. ఫస్ట్ టైం మన ఇండియాలో మన దేశంలో ఈ ఎంఆర్ఐతోని లీనియాక్ కూడా అనుసంధానం చేసి ట్రీట్మెంట్ చేస్తే ఏమైందనంటే ఎంఆర్ఐ చేసుకుంటా రేడియేషన్ ఇవ్వచ్చు. దాంతో ఏంటంటే కరెక్ట్గా మీకు అవసరం ఉన్నంత కాడికి రేడియేషన్ ఇవ్వచ్చు. ఎక్కువ డోసులు ఇస్తే ఏమైందంటే కిల్ రేట్ ఎక్కువ ఉంటుంది. అందుకని పేషెంట్ సర్వైవల్ రేట్ ఎక్కువ అవుతుంది. అందుకని మిషన్ తెచ్చిపెట్టినాం. ఇది ఎట్లా ఉపయోగపడుతుంది? క్రిటికల్ స్ట్రక్చర్స్ను కాపాడుతుంది. డైనమిక్ ఉంటుంది. ఇది అంటే ఎప్పుడు చూసుకుంటూ చేసుకోవచ్చు. రెండోది దీంతో పేషెంట్ యొక్క సర్వైవల్ రేట్ పెరుగుతుంది. అంటే 30 రోజులు ఇచ్చే బదులు 5 రోజులు ఇచ్చొచ్చాయా? అంటే వాళ్ళు నెల రోజులు రావాలంటే ఎవరికైనా బాధనే కదా. 5 రోజులు 3 రోజులు 3 రోజులు కొన్ని 5 రోజులు కొన్ని అట్లా.
Elekta is full-focused radiation oncology company headquartered in Sweden, Stockholm. We have manufacturing facilities across the globe and we have offices across the world, many installations across the world as well. Elekta is into multiple businesses but specifically focused around radiation oncology. We have products addressing the neuro segment, started off as a gamma knife production company way back, 50 years back. In fact, incidentally, Elekta is celebrating its 50th year. Gamma knife was the premium product. We also have linear accelerators, which are used to treat oncology using radiation. We have brachytherapy, which is the internal radiation for, again, specific cancers. Also, the software solutions which span across the entire hospital segment as a backbone of hospitals, and also multiple software applications and products which are very patient specific and patient centric. So linear accelerators are used to treat specific tumors. What we do generally is to identify where the tumors are or lesions are, mark them on the planning and radiate them. While doing that, we also are conscious of the surrounding tissues, surrounding organs and tissues, and have a safety margin to ensure that we don't affect them. So in doing so, we have the linear accelerators, we have precision radiation being delivered to the patient to kill these cells. Over a period of time, these linear accelerators have evolved, and today's linear accelerators are extremely high on precision and extremely good on the efficiency. We still have some challenges in terms of the tissues and organs surrounding these tumors, primarily because we do not know exactly what is happening to these tumors or the pathology when it is being radiated. We image the organ at some point of time and we radiate it slightly at a different time. MR imaging, the technology which we are talking of, is a combination of MRI, the gold standard in soft tissue imaging, and linear accelerator, the powerful linear which is used to radiate. What happens in this case is, as we radiate the patient or as we radiate the specific organ, we are also constantly imaging through the gold standard MRI. We are able to visualize exactly what is happening to that specific tissue or organ. We are able to visualize if there is any movement. We are able to visualize if there is a pathological change, and accordingly we are able to adapt the radiation which is being given. So adaptive is the word over here. Very high visible structures because of the very high caliber of the MRIs in soft tissue imaging leads to we knowing exactly where we need to radiate, which means we are in a better position to allow a lot more radiation, or as we call dose, to kill those cancer cells. Now, this leads to significant advantages. The typical linear accelerated treatment around certain organs, for example, takes probably 6 weeks, 7 weeks, 8 weeks, because the radiation there is comparatively lesser. As I mentioned, we are giving a slightly higher margin. In MRI, because we know exactly what we are radiating, we are able to focus it on that specific area, and therefore we can increase the dose. And in doing so, we are decreasing the time of radiation required for the patient, which means we are significantly reducing the time for treatment. And that is a big advantage when it comes to this new technology. Also, as I mentioned, the surrounding tissues, the surrounding organs are very clearly visualized and seen. there are certain places or certain organs which are very close to the tumors, and in a conventional method, there's a huge risk, and therefore sometimes even the treatment is avoided. In an MRI Linac, since it's very highly visible, we know exactly where to demark the radiation. We are able to treat even those tumors which were not being treated earlier. So first, this is the first MRI Linac which is going clinical in India. So we are extremely proud to partner with Yashoda in bringing this MRI Linac into India. And of course, Hyderabad being the tech city, we are all the more privileged to have the MRI Linac technology getting inaugurated or getting launched in India in Hyderabad. Having said that, this is a technology which was launched 2+ years back globally, and it has been adapted very significantly across the globe. We already have 60+ installations across the globe in the short term. We are already looking at a few more equipment coming into India in the next few months. So you will hear of installations in the next few months across India. The good thing about this MRI technology is the adaptive perspective, which I was talking of, adaptive radiation. And that's going to be the future. So in a few years' time, you would realize this is going to be the way forward as we move forward. You also asked about the time frame. Yes, this MRI technology will require the bunker construction, will require the infrastructure to support it. And as in any other installation, it will require a bit of preparation, a bit of installation time. And since this was the first equipment, we also had to go through the specific protocols associated with the regulatory authorities, as this is a radiation equipment, and we have quite a good governance and protocol, rightfully so, which we have gone through. Going forward, yes, we will see a lot more efficiency and productivity in terms of adaptability of MRI Linac. Thank you.